When you're faced with a rare condition that falls outside of any particular doctor's area of expertise, I found, unfortunately, that most doctors do not respond the way one might wish. We're all looking for Dr. Gregory House, that Sherlock Holmes in the medical profession who fits with the Mensa profile of loving a tough puzzle and being so intrigued at the anomaly that they just have to dig in and solve for the unknown. We all want that doctor with the whole team surrounding a whiteboard going for the answer. But finding and getting in front of that person is proving a challenge. I'm going to pursue it nonetheless. Even though most doctors are unquestionably intelligent, most I've encountered still seem to lack that inner drive, that inner need to solve the problem that comes at the highest levels. It's that or they just simply can't be bothered. They become easily frustrated that the diagnosis is not what they test for the first couple of tries. I've heard them say, well, it's not XYZ, so I don't know. You'll have to go somewhere else, or not my area. Good luck. You know what it's not? Well, it's certainly not the patient's area of expertise. And the primary care physician is even more of a generalist than others, openly admitting she has no idea where to look next. So what do? Well, I'm reaching out to you, the world, because someone else out there has or has had this same or similar condition and either died from it or recovered. Someone found a diagnosis or a solution, and I want to know what it was. Someone ran a test and it worked. And someone out there may be intrigued enough, someone who has the facility to connect these disparate dots together and can evaluate cause and effect in a multidisciplinary out-of-the-box framework, who will want to take this on. So I am crowdsourcing a diagnosis. And the purpose is not simply to solve this for my family, but I want something to be out there for the next victim of whatever this is. I will post updates when we have them. I'm not a heavy YouTube producer, but I will figure out how to make chapter links below so that you can jump to wherever you like in this post. Patient's medical profile. Patient is an 82-year-old female, 5'1", currently 130 pounds, down from around 160. Quite active, still driving, doing all daily functions autonomously, still creative and social with no psychological impairment. Basically looks and acts healthy and as if still in her 60s. Has high blood pressure, high cholesterol, and decreased kidney function, but all are well managed and none are critical. The only hospitalization prior to this, and I mean in the entire 82 years of life, were tonsils being removed as a child and one natural childbirth. That's it. Did also have one broken arm, also from childhood, but other than that, have never been sick, not even the flu or COVID. Has a history of high sensitivity to smells, which have somewhat of an allergic reaction occasionally, making like a tickle in the throat, which causes like a dry cough and sometimes can put her down for a day if the smell is persistent and she can't get away from the scent. But other than that, no allergies to medicines or foods. Her occupation before retirement was as a registered nurse, and there has been no known exposure to substances that are detrimental to health. Onset of symptoms. November 6th, 2024. On a car trip, we were driving across several states for a family wedding that was to happen 2 days later. We load up food to eat along the way so we don't have to buy fast food or stop for long periods. She first noticed that the grapes tasted off, but they seemed fine to me. The next day, she noted a few more foods just not tasting right or good, and then by the time we got to the wedding, she tried everything, but just nothing tasted good. And it really should have, because it was quite tasty. So the next day at family dinner, she could barely muscle through some of her favorite foods. And by one weekend, we were back home, but everything was tasting foul and rancid. My first instinct for diagnosis was COVID. I had lost taste when I had it and still haven't regained a few smells and tastes. And some of my tastes were altered for a while, like certain, but only specific foods like coffee and onions, I just didn't like. But she had no other symptoms and hadn't had COVID, so she didn't think she had it. Most of us had not had the COVID vaccine. She had the first Moderna vaccine in order to attend a wedding, and it was required back at that time. We thought perhaps this is why she wasn't seeing any other symptoms, so we tested her, still thinking it was COVID, but it was negative. And just in case it comes up again in your thought pattern, she's been tested several times by hospitals and doctors, all negative. It's not COVID. For further detail, her smell, which is typically connected a lot to your sense of taste, it's completely unaffected. Another dissimilarity with the typical COVID presentations. Food smells wonderful and normal to her, but when she puts it in her mouth, there is such a strong, rancid, spoiled, and putrid taste that she involuntarily gags. And when trying to muscle that food down, she often will end up almost vomiting. This is all food, even water. And she can taste this taste in her mouth even when no food is present. It's always there. She vomited drinking water at one point in December. So she describes the experience, if you can imagine eating something that has spoiled plus a metallic overlay on top of it. So you might think, well, this can't be that bad because, I muscled through COVID and I just didn't eat the things that tasted awful. But this is all foods. For a couple of weeks in November, she was able to force down like a half a peanut butter sandwich or oatmeal with a ton of sugar in it, but eventually that wasn't working. And as I said, the taste is there in her mouth even without eating. She'll sometimes try to take water, swish, and spit it out really quick to try to clear it, but it becomes extra pronounced whenever she tries to eat or drink. Narrowing down the condition. Dysgeusia is a condition characterized by an altered or distorted sense of taste. But dysgeusia is a general term and it covers many types of taste disorders. Now, most of these are just annoyances that one can get through. For example, what I had with COVID was a loss of taste with a few items tasting really distorted when I got my taste back. The complete loss of taste I had at first was called ageusia. It's not fun to eat, but you can eat. It's just not satisfying, right? Hypogeusia is that reduced sense of taste. Aliageusia is when something that usually tastes good tastes bad. I had a little bit of that, but only with certain foods like coffee and onions when I started getting my taste back after COVID. Phantogeusia is tasting something that isn't there, like a phantom taste. Hypergeusia is an increased sensitivity to certain flavors. And then parageusia, which is what my mom is suffering from, is a distorted taste, a bitter, rancid, and metallic taste. Often taste disorders are present with other symptoms, not least of which is some type of smell disorder because the sense of taste is again tightly woven to smell. But this patient has parageusia with no known accompanying smell disorder. Within 1 week, she was struggling to find anything that she could eat, and within 3, she'd vomited even while drinking water. There's very little out there about this condition, and it's very challenging to find others experiencing it. Most of the doctors we met in the hospital had never even heard of parageusia, though they recognized the term dysgeusia and looked at me skeptically when I said it. Unlike many of the taste disorders, parageusia is not just annoying and disappointing. It is life-threatening. Your body has this automatic reflex response to expel foods that taste spoiled or dangerous. Think of taking a swig of spoiled milk because you didn't smell it first, or eating anything else that has thoroughly spoiled. You just can't eat it. Your body gags and vomits as a protection measure. Now imagine that it's not just some foods, but it's all foods and all drinks causing this effect. You need food and drink to live, so how do you live? And remember, again, I'm going to say there is no affected sense of smell. And I'll also add, her breath has no bad odor, because that question has come up a lot. Okay, medical interventions and current state. We went to the ER twice, the 1st and 3rd weeks of December, for severe weakness due to dehydration. I'm sure at this point her kind of poor kidneys were having lots of struggles too. They gave her fluids, and then they gave us a referral to a gastroenterologist and ENT doctors. Both of those proved fruitless. They did not determine that anything was causing this. The third visit to our ER was the day after Christmas, and this time it was both for weakness and severe malnutrition. So we decided to try a different hospital this time around too, and fortunately found an admitting doctor with compassion because her labs were poor enough this time to be admitted. We were getting nowhere outside of the hospital, and we needed to somehow get her stabilized so that the malnutrition was not keeping us from being able to figure out what the diagnosis was. But I did hold hopes that the hospital would run enough tests to figure it out. But we did, at the very least, need a way to sustain her while investigating, as we had to fight for every little test and each millimeter of learning what was going on. A very healthy woman for her age, she was certain at this point that she would be dead by the end of January if we didn't figure out how to get her nourishment. We had several tests done in the hospital, which I'll cover next, but by the end of that hospital stay of 3 weeks, she had a PEG stomach tube inserted. Currently, she still has that. That's the only way that she's getting nutrition. She's taking both water and nutritional shakes through that tube, and she has distilled water and takes some medications by mouth. So the diagnoses that it is not. There is a long list of things that can distort taste or give a metallic taste. We had quite a few tests run once we got her admitted to the hospital, and since that time. So we're able to check most things off that list of possibilities, and I need some more things added to the list for us to click through. So number 1, tobacco use. She's never used tobacco. Cancer treatments. She's not being treated for cancer, though she administered chemotherapy to many years as an oncology nurse. She's not been treated nor taken any cancer treatments. Other medications. For a woman of her age, she takes very few medications. She has a blood pressure pill and a cholesterol med, which is not statin, and several supplements that she takes like vitamin D. None of these were newly introduced, and it's highly unlikely they would suddenly cause the onset of this symptom. Nevertheless, if you find it important and you're trying to solve this for us, I can provide a list if you reach out to me directly with a good enough rationale for reconsidering the medications as a cause. I should mention that she was also getting bioidentical hormone replacement therapy, which included estrogen and testosterone pellets that are inserted and progesterone by mouth. I know this is a very controversial issue with no seeming middle ground, but she'd been getting these hormones for over a year, had a ton of positive but no negative side effects. The positive side effects were she was sleeping better without having to take addictive sleeping aids. She had better energy levels. She had less dryness everywhere from her skin and her scalp and her eyes and everywhere else. And her mood, her spirit, and everything were just improved. However, given that we have this and we just want to eliminate everything, she has suspended getting any more pellets at this point just to eliminate it as a possibility. Even though there's very little evidence to indicate that these hormones would cause parageusia. But with all this in mind, it's not believed that any current medications are causing the parageusia. Another thing that can cause a bad taste in your mouth is poor oral health. She has seen a dentist and nothing is present to cause it. Her teeth and gums are in good condition. She still has her natural teeth. And though some of her fillings are old, none of them are degrading. She has no dental appliances, and there is no odor to her breath. She's also seen an oral surgeon just to be extra certain. So at this point, we have ruled out any sort of dental condition. She does not have dry mouth or Sjogren's syndrome. She's got plenty of saliva, so it's not due to this. Other ENT issues. After that first ER visit, as I said, we got referred to an ENT doctor. They've scoped her sinus cavities, and there was nothing much seen. He saw this very small area of pus. So just in case, because of the other effects she was having, he prescribed an antibiotic, but it did nothing except perhaps aggravate the stomach lining by taking the antibiotics on a very, very empty stomach, which I'll address when we get to the gastroenterology part. We've also had an X-ray done, a CAT scan, and an MRI of her head. These have been reviewed by more than one doctor. She does not have an ENT infection or any other discernible issue that the ENT doctors can detect. She's not currently experiencing any allergies. So there's no obvious ENT cause to this issue. Other infections. She has no symptoms or signs of any other infections. Her white blood count is not elevated. Medical conditions. There are several medical conditions that can cause a bad taste in the mouth. So let's go through what we know. Age. While age can diminish taste, she's not experiencing any diminished sense of taste. It's quite strong, it's just foul. So again, it's not ageusia or hypogeusia, it's parageusia, which is not associated with age. She's obviously not pregnant, which is another thing that can change her taste. Nerve damage from trauma or surgery. She's had no surgery or trauma. Other medical conditions. She does not have Crohn's disease. For diabetes, she does not have, nor has she ever had diabetes or any blood sugar issues. She has no multiple sclerosis, no hypothyroidism, no Alzheimer's, no Parkinson's. When it comes to gastroenterology, she has no history of GERD, or acid reflux, no heartburn, no ulcers, or any type of gastrointestinal issues up to this point. She was scoped and biopsied in the hospital. Stomach did show tiny ulcers at this point after not eating for more than 2 months, but it's believed that these occurred more recently from irritation as she continued to take her medications, including those antibiotics that were prescribed by ENT, on an empty stomach. But she had no pockets, no outcroppings in her esophagus, no fungal issues, nothing else, and the gastroenterologist assured us that even those tiny ulcers, like they would not be causing this, and he could not find anything from his area of expertise that would be causing this taste in her mouth. So they're not causing the parageusia. Kidney failure. The patient does have decreased kidney function due to age, but is not in kidney failure. Due to hydration, the kidneys were a little extra stressed, and one ER visit showed her eGFR down to 26. However, it increased back up to 46 mid-January because of hydration and nutrition. Her creatinine has been historically a little elevated in the 1.3 to 1.4 range, but by the hospital admission in late December, it had reached even 2.0, but quickly decreased to normal levels with hydration. Her BUN levels are also completely normal. Nephrology has reviewed her again once even post leaving the hospital, and said that her kidneys would not be causing the parageusia at this point. Liver failure. Her ALT, her albumin, her bilirubin, and protein levels are all normal. There is no indication of any type of liver impairment. Hematology. In the hospital, her blood counts were low across the board due to malnutrition. And the malnutrition was subsequent to her having the parageusia. Her hemoglobin got as low as 8.8 and hematocrit down to 26%, but as soon as she began receiving nutrition, first through an NG tube, through her nose, and later through the PEG tube, her numbers began to move in the right direction, demonstrating that her numbers were low due to the malnutrition, not to another cause, which would have then been a cause for the parageusia. By mid-January, her numbers were still low. Her RBC was 3.4. Her hemoglobin was 11.1, hematocrit was 33%. However, as you can see, they were continuing to improve, and they're now back to normal. She had a follow-up with hematology in February. All her counts are good, so there's no indication of any kind of issue from a hematology perspective. Another thing that can cause parageusia could be vitamin or mineral deficiency. When we got to the hospital, when they ran the lab, she was down in quite a few nutritional areas due to simply not eating and malnutrition. But those were brought into line in the hospital through IV supplements, and even when they got back to normal, it had no corrective effect on the parageusia. Take a closer look at a couple culprits that are often brought up. A B12 deficiency can cause a metallic taste. B12 was strangely very elevated, over 1700. And I say strange because she's historically needed to take periodic B12 injections, though she hadn't taken one in a few months. She did start taking some chewable B12s with the hormone replacement therapy, but given her history, I find it very odd that her body suddenly started retaining it so much when she's always been deficient in it. I brought this anomaly up to the doctors, but they simply said low is bad, high is fine. There's no study showing any issues with too much B12. Only a deficiency causes a metallic taste. I think they kind of looked that up without really understanding the why behind it, but it's what the study shows. So because this was the only other change in her body's behavior, though, I still hold it as a presenting anomalous factor to her historical health situation. Nothing else that they typically scanned for in labs was off or was known to be a cause, but come to find out they don't scan for all that much. Let's go to zinc and neurology together. So meanwhile, while all this is going on, I'm researching over the web and I'm asking questions from every doctor, and I have no medical background. Case in point, then I found an article, which I've linked below, from a doctor who had a patient, a 73-year-old male, presenting with what sounded the same, with the exception that he had the addition of a mild smell disorder. This patient was put on a feeding tube as well, had lost a lot of weight, was becoming severely depressed from decreased quality of life. The doctor had founded a taste and smell clinic somewhere, I think it was in Texas, and found that a combination of zinc and gabapentin helped this man. So within 3 weeks, that patient had begun to be able to eat some soups and vegetables. I looked up the authoring doctor to call him, but he had passed away. And I found a taste and smell clinic at Vanderbilt University in Nashville, which wasn't too far from us, but it now seems to be defunct. So I shared the article, however, with the hospitalist and asked him if he would at least read the article and potentially reach out to a taste and smell clinic to consult with doctors who headed it up, since this would still seem to be a mystery and their area of expertise and not his. Not one doctor would do it, and they seem to almost be offended that I would ask them to consult with someone. Strikes me as very odd, but we'll put a pin in that. So I kept pressing on with every medical professional that we saw, and I kept sharing the article until we finally got a consult with neurology in the hospital. Hooray. And then they finally also agreed to check her zinc levels. They had to send out for this because apparently a hospital can't test for zinc. Even though low zinc levels can cause Parageusia, this test had not been done yet after 2 weeks in the hospital. And when we finally got the result back, bingo, her zinc was 0. So we began that supplementation. And then in our meeting with neurology, an MRI had been done on the brain to rule out any atypical stroke response or any mass growing and pressing on any particular nerves in the brain. The MRI was clear. So the neurologist did an EEG to look for small seizures, but it was clear. The neurologist stressed that we cannot actually see nerves to inspect them. There's 3 main nerves that facilitate the sense of taste to the brain. The vagus nerve is a big one that carries that bitter taste. And so they agreed with the suggestion in the article I found and prescribed gabapentin, which is used to relax nerves, along with that zinc supplementation. So closing out our inpatient hospital experience and matching what I'd found in the article 2 weeks prior, they decided to give the patient a PEG feeding tube to stabilize nutrition and hydration at home while we try to diagnose and fix this, and then prescribe gabapentin and zinc just to see what happens in case it worked for her as well. Where we are now. It's now March. We are at the 4-month mark since this started. We are still taking gabapentin and zinc. Zinc levels have been normal for more than a month, and this regimen is having 0 effect. So at least we eliminated this particular option for treatment, which I suppose is a step forward from one perspective. Patient in the article that I found, taking this regimen, as I said, had definitely improved by 3 weeks, eating soups and vegetables, but we're definitely not there at all. Positive note, the patient has at least stopped losing weight and is not dehydrated. However, needing the PEG tube and this diminished quality of life starting to wear on her spirit, right? It's not a fun way to live. It's not enjoyable. And there's also that ever-present risk of infection. You basically have a stab wound going right through your stomach that you're having to make sure that you take diligent care of every day. She has met again with gastroenterology, with the ENT doctors, with an oral surgeon, a dentist, hematology, and nephrology. There is nothing that they can find causing this. Her primary care doctor also doesn't know what else to do. Here's me, a loved one, trying to think this through as logically as I can from an uneducated perspective because I'm not medically trained. She can taste this foulness in her mouth even without eating. So I brought up the question both when we were in the hospital and to her primary care doctor, saying, why don't you test her saliva just to see what's there? Perhaps something will show up that shouldn't be there, and then we can look at that and address that, like see where it's coming from, how is it getting in her system, how do we get it out of her system. But the response was, well, I'm not even sure we can test saliva. And I'm pretty sure that we'd have to tell the lab what to look for, and we don't know what to tell them to look for. Well, I'm sorry, from my perspective, that's like as dumb as a wooden post. No offense to the wooden post. There are herbalists that can test saliva. You see all these saliva tests all over the internet. Why shouldn't a hospital or some type of medical lab also be able to look at and evaluate what's in there? Maybe there's heavy metals. Maybe there's something else that can cause a metallic taste. Now, we could go to one of these herbalists out there, which I'm still leaving out there as something to do, but we would really rather prefer having a medical assessment of this, not a screening for supplement sales, which I think most of them are trying to just see where you're lower, and here you can buy these supplements from us and get those up. So I really want to go to a place that's going to do a full scan, not just look for certain things. There are also other possibilities that I can think of with my limited knowledge. Like, while it's not bacterial or fungal, could it be a rare viral cause? Not COVID, not flu, but some other virus. And if so, how can we identify it? If we do identify a virus, at least we would know and then could assess if there was a remedy to it, right? So what is my ask of you? Much as I'm reluctant to go so public with private family matters, I'm presenting this online for two reasons. First, can anyone help? What else should we test for? Have you seen this before? If you have seen this, what should we test for? What has worked? What hasn't worked? In fact, if I have any Mensa community friends out there that are in the medical field and have that itch for a challenge, will you take this one on? And second, this type of situation can make a person feel quite isolated and helpless, right? Do you want to help out your loved one? And so if there are others out there who are experiencing the same issue, I wanted to let you know that you're not alone. And if I find a solution, I will post it here so that you know what worked for us. If you find a solution, please reach out to me. I've set up a special email address, should be showing on the screen here somewhere, just for this issue. And then lastly, but certainly not least, in fact, I would call it most, I am a Christian and I firmly believed in the gift of healing. And so I invite all my prayer warriors out there to please join me in prayer for a supernatural solution. There is nothing that I would like better than for this situation to become a praise report and a declaration of God's love and power. So please reach out via email with any thoughts, ideas, diagnoses, prayers, encouragement. I will post additional update videos as soon as anything new presents itself. But if you've gotten this far, I thank you for your time listening and for any direction or help that you can provide to our family. God bless you.